Hi, this is Donnie Abel from Abel Wellness. We're going to talk about some of the go-to things that we use with our clients that could probably help benefit really just anybody that's been doing a lot of squatting, lateral movements, load-bearing type exercises. So this could really help that whole low back, that posterior chain and hip area of our body that takes some beating sometimes through some of the movements and things that we do. So we had a request to kind of do a couple of these things here that might help. This is the first part of the series that we're going to show. This is for release and relaxation and kind of more of a therapeutic direction for your body until we get into the using more mobility and strengthening of that area. So this is part one. So what we like to do is we like to use a heating pad. So again, there's an array of different sizes. I recommend if you have one, and if it's not big enough, then obviously get two of them. You can pick up all kinds of ones. You can heat in the microwave, into a heater. You got ones you can plug into the wall. This goes on. I like the ones that will they're more of like a moist heat or something you can put in a microwave because they're pretty quick to do that, to heat up. We also have some of our go-to things that we like to use that we use in the studio. This is our Cool Azul Sports Gel, our Cool Azul Pain Relief Cream, two awesome products, amazing products, and Deep Relief as well, and our Pan Away. And all four of these products are amazing, great for the gym bag, and really just a must and a go-to and we find a lot of our clients get tons of relief from this. It's very therapeutic, so check it out. So anyway, the heat is what we'd go to first. We'd have our client lie down, and we'd slide that underneath. Typically we'd have everything set up nice for them to where they would administrate and put themselves down into a nice warm bed of heat. So place that around the pelvis, low back, and just kind of place it where you feel like it's the best place for you. Heat's typically they say usually 10 to 15 minutes, but if you're short on time, I would always say maybe heat for say 5 minutes, 10 minutes, and maybe incorporate some movement where you're lifting your legs up. You can kind of do some things like that, really to relax the tissue, get the heat in there and breathe. Okay, so after we had used the heat, we could take that out, and we would use things such as a foam roller. So there's so many variations and so many different things you can use for foam roller on your back here in your pelvis. So what we would do is we'd have you lift up, one of many things we'd have you do. We would put that into the lower back pelvis area, so I should be able to pull my legs up in neutral without losing the neutral spine, okay, without the pelvis tilting. So it shouldn't be pelvis tilt forward and arch the back, and the pelvis come back in and the lower back drops down. I should be able to keep that neutral and pick the legs up. So then holding the legs up, I could go into some movement, toe taps, things like that. You can even lower both legs and up. Keep it simple. Some people will hold on to the roller if they feel like it's sliding away from them. Then we go into a little bit of a lateral rotation, and I'd go as far as my body was going to allow it. The hip of the other side would come up, and I should feel this into that hip, full outside of my hip, and then of course in the outside stretch of the lower back as well, and then over to the other side. And you could hold for a cycle or two of breath before you bring it back up on the exhale. And just really, the main thing in this is to go slow and investigate where there's a tension point at, or a knot, or an X marks the spot. Another variation of that could be you could also cross the leg over into like a 4, and then you could go, and that kind of opens the hip up a little bit more. So then you can go over to one side. You could even lower the leg down, like you're toe tapping and coming back up. Bring the leg over and do the other side, and so forth, and come back up. Just investigating where these spots are at, and then of course obviously change sides. You can change to the other leg. Okay, so that's one variation there, and then of course obviously getting it aside, we can have you go up and use the roller where you're, after that you get into where you're getting lower back, And from here you lift up and roll back and forth. Okay, and then you want to, it's like ironing out lumps in cookie dough. It's like how long should you roll the cookie dough out? Well, until the lumps are gone. But again, I would say take it a lot easier and don't overdo it. Don't overdo when you do this release work. It's not meant to do a lot of repetitions. It's meant for you to cause relaxation and release. So if you're on it for 25, 30 minutes trying to do release work, you're going to find this might work the opposite way. So it should not be where it causes tension. Another thing we like to do that you could go right after that, you could place this, so that would be horizontal. You could turn it the same way, and your spine fits right down in that groove of 2 tennis balls that we use with athletic tape. So we could put that right in the lower back, somewhere along the line, and we could roll and just find a spot there, and you can just keep moving it down. And of course you can rock side to side, you can cross your legs, you can do a lot of similarities with what we did with the foam roller. You could pull your knee into chest, just keeping it stable, things like that. And you could even work down into that hip. So you could even move it out like so and roll onto it. You could even turn it long ways if you need to roll through the hip. So double tennis ball is great. Single tennis ball works as well. And then of course you can choose a side and this is you buy in a pet store. It's a big tennis ball we like, it's one of our favorites. And then you just lift your body up and roll on it. Just make sure that you can control how much weight you're on there when you're on that. Just rolling back and forth on that. Don't roll over the spine. And then you can work it from the upper part of your back down through the lower back and down into the hip. So really this is for the lower back and pelvis, but again the ball can be used for a lot of different other areas. And just roll out into that hip girdle and find right where that line of your pants is and your hip and go right on the back side. So these are some of the things that you can do that are simple. It doesn't take long to do. The ball work are more pinpoint, so you're gonna feel a lot more versus the foam roller, and that's gonna go per a spot that you find, usually 30 to 60 seconds, no more. Make sure you breathe and relax. So that's the first part of our series, and from Able Wellness, I'm Donnie, and I'll see you on the next part. Take care.